3 in the morning. You're wide awake, standing in a dark hallway, waiting on your own bladder, again. You tell yourself it's just age. Everyone your age gets up at night, right? But a part of you wonders, is this normal, or is your body trying to tell you something? Here's what I can promise you. By the end of this video, you'll know exactly why this happens. You'll know what's different for men and what's different for women, and you'll have a plan, starting tonight, to get more of your sleep back. I'm Dr. Thomas Hayes. I've spent many years practicing urology, and nighttime bathroom trips are one of the most common complaints I hear. Not because it's dangerous, most of the time it isn't, but because it steals something precious, your sleep, your energy, your mornings. Today, we're covering 2 tracks. First, the men's track, what's really going on with your prostate and the myths that scare men more than they should. Second, the women's track, the bladder control exercises that actually work and why urinary infections keep coming back for so many women after 50. And stick around for item 3. There's a connection between your bladder and your sleep that surprises almost every patient I share it with. So, let's answer the question first. Is frequent nighttime urination dangerous, or is it just aging? The honest answer is, usually it's aging. But aging isn't one single thing. It's several small changes stacking together. Here's the mechanism behind almost everything we'll cover today. As you get older, your bladder's walls lose some of their stretch. Think of a balloon that's been inflated 1,000 times. It still works, it just doesn't hold quite as much air as it used to. At the same time, your body's overnight hormone signal, the one that normally tells your kidneys to slow down urine production while you sleep, weakens with age. So your bladder is holding less while your kidneys are producing more at exactly the hours you want to be asleep. That's the baseline for everyone. But layered on top of that baseline, men and women each face a separate set of triggers. That's why we split today's video into 2 tracks. Let's start with the men. So why does the word prostate scare so many men? Your prostate sits right beneath your bladder, wrapped around the tube that carries urine out, your urethra. As men age, that gland tends to grow. Doctors call this BPH, benign prostatic hyperplasia. In plain English, a non-cancerous enlargement. Picture a garden hose with a clamp slowly tightening around it. The water still gets through, but it takes more pressure and more time, and it never feels fully finished. That's what an enlarged prostate does to your urine flow. Here's what people mistake this for. The moment a man notices he's going more often, his mind jumps straight to cancer. But in the vast majority of cases, this is benign enlargement, not cancer. Your action step: at your next checkup, ask your doctor specifically for the IPSS, the International Prostate Symptom Score. It's a short questionnaire that turns, "I think it's worse lately," into a number your doctor can track over time. You might be blaming this one on drinking too much water before bed. For a lot of men, that's not the real problem. Many common blood pressure medications and diuretics are designed to move fluid out of your body. If you take them in the evening, they're often still working while you're trying to sleep. There's also a second piece. During the day, gravity pulls extra fluid down into your legs and ankles. You may even notice some swelling there by evening. When you lie down flat at night, that fluid doesn't just disappear. It moves back into your bloodstream and eventually into your bladder. Your action step: ask your doctor or pharmacist whether your specific medications can be safely shifted to earlier in the day. Never change a dose or timing on your own. This is a conversation to have with them, not a decision to make alone. Quick pause. If this is matching what you're going through, drop a comment below with your biggest nighttime frustration. I read these and it shapes what we cover next. Now, here's the one I promised you. This one surprises almost everyone. If you snore heavily, or your spouse has ever told you that you seem to stop breathing for a moment at night, that could be sleep apnea. And sleep apnea has a direct link to nighttime urination. When your breathing is repeatedly interrupted, your body sounds a kind of false alarm. It releases a hormone that tells your kidneys to produce more urine right in the middle of the night as a stress response to the drop in oxygen. What people mistake this for, they assume snoring is just an annoyance for whoever's sleeping next to them. In reality, it can be quietly driving your bathroom trips. Your action step: mention your snoring and any witnessed breathing pauses to your doctor. Ask whether a sleep study makes sense for you. If you're finding this helpful, take a second to hit like. It genuinely helps this reach more people who need it. Now, let's shift to the women's track. This is where I want to bring in Robert and Diane. They're a composite of patients I've worked with, not one real couple, but a picture built from many stories like theirs. Robert, 72, had started avoiding evening coffee with friends because he didn't trust his bladder anymore. Diane, 68, had quietly stopped her weekly walking group after a urinary infection returned for the third time that year. Here's where it gets more urgent for a lot of women, because the fix is often simpler than they expect. Your pelvic floor is a group of muscles that work like a hammock, stretched beneath your bladder, uterus, and bowel, holding everything in place. Childbirth, menopause, and simple aging can all loosen that hammock over time. What people mistake this for, many women try to practice by stopping their urine stream mid-flow over and over. Please don't make that a habit. It can actually confuse your bladder's signals over time. Instead, here's the real technique. Contract those pelvic floor muscles, the ones you'd use to stop passing gas, for 5 seconds. Release for 5 seconds. 10 repetitions, 3 times a day. Diane started this after her doctor mentioned it almost as an afterthought. She didn't expect much from it. We touched on this earlier. Remember the hormone changes we discussed with your bladder wall losing some of its stretch? A similar hormonal shift is behind this next one. After menopause, estrogen levels drop. That tissue lining your urinary tract depends on estrogen to stay thick and protective, like a coat of paint that keeps metal from rusting. As that layer thins, bacteria find it easier to take hold again and again. What people mistake this for, many women blame themselves, thinking it's poor hygiene or something they did wrong. For many older women, it's simply biology, not behavior. Your action step: ask your doctor specifically about low-dose vaginal estrogen. It's a topical option some doctors don't mention unless you bring it up first. This is what had been happening to Diane. 3 infections in 1 year had made her afraid to even leave the house some days. One more piece, and it works alongside everything we just covered. Think of your bladder like a muscle you can retrain, the same way you'd gradually stretch before it feels comfortable. You don't force it all at once. You extend it gently over weeks. Start by using the bathroom on a set schedule, every 2 hours by the clock, whether you feel the urge or not. Once that feels manageable, stretch the interval by 15 minutes, then hold that new interval for a week before stretching again. Robert started shifting his blood pressure medication to mornings and brought up his snoring at his next appointment. Diane kept up her pelvic floor routine and started the vaginal estrogen conversation with her doctor. Within 2 months, both of them were sleeping through the night without a single trip to the bathroom. I want you to hear this clearly. What we've talked about today is not something you simply have to accept. It's predictable. In most cases, it's manageable, and very often it can be significantly improved. I know some of this might sound almost too simple, moving a pill to the morning or squeezing a muscle for 5 seconds, but small, consistent changes are exactly what move the needle here, not dramatic overhauls. Let's bring it all together. For the men, 1, an enlarged prostate is usually benign, not cancer. 2, medication timing can matter more than how much water you drink. 3. Snoring and sleep apnea can quietly be driving your nighttime trips. For the women, 4. Proper pelvic floor exercises done consistently can rebuild your bladder support. 5. Recurrent UTIs after menopause are often hormonal, not hygiene-related. 6. Gentle bladder training can gradually extend the time between bathroom visits. Here's your one step for today. Pick just one action item from this video, whichever one applies to you, and bring it up at your very next doctor's visit. Write it down now if you need to, so you don't forget. If this video helped make sense of something you've been dealing with quietly, subscribe and share it with someone else who needs to hear it. And as always, this video is for educational purposes only. It isn't medical advice. Please talk with your own doctor before making any changes and never stop or adjust a medication without their guidance.